Hi, this is Frank with a frank opinion. Bernie Sanders has officially ended his campaign for president and endorsed Joe Biden in order to prevent Donald Trump from succeeding in having a second term. I get that. But we should not allow Bernie Sanders to leave his effort without leaving us with something to work with. As he has said a million times during his campaign over the last 4 years, it's not about him, it's about us. We can't be led to think that Joe Biden, the Democratic Platform Committee leading to the convention, the Democratic National Committee, a vice president choice, even if it's Elizabeth Warren. I don't recall any vice president having the ability to change the course and the policies of a president. He's got to leave us with something else. Why? Because Joe Biden will not lead an effort to a Medicare for All universal single-payer program. He simply will not, of his own accord. The last president that we had that had a passionate commitment to establishing a national health care program, publicly funded in terms of insurance, was Harry Truman, 75 years ago. A talk by a Karen Palmer to the spring meeting of the Physicians for a National Healthcare Program in 1999 said the following: legislative success requires active presidential leadership, the commitment of an administration's political capital, and the exercise of all manner of persuasion and arm twisting. Joe Biden is not that person. So I think Bernie Sanders' work is not done. And I think what he needs to do is whether it's by Zoom or whether it's when the pandemic lifts and we can actually meet, that he underwrite with his remaining campaign funds a convening of the hundreds of organizations and groups that have been fighting for Medicare for All for years. That he underwrite with his remaining campaign funds a process, a planning process that leads to an institution, and that he endows that institution, again with monies from his campaign coffers, in order to jumpstart its work. That institution, national, would have one goal, and that is the establishment of a national organization for the enactment and implementation of an enhanced Medicare for All health care program for the United States. Why Med for All? Well, if it hasn't become obvious, our current crisis with this deadly disease, deadly pandemic, COVID-19, has destroyed every argument against having a Medicare for All single-payer program. The main argument, having a choice and keeping your employer-sponsored health care, has been destroyed by COVID-19. Secondly, we have legislation in place in the House, as you know, 1384, and the Senate, 1119. We've got a 30-year history of study after study, research study after research piece, unequivocally pointing to a Medicare for All single-payer program that will save individuals and families tons of money, up to 99% of Americans that don't make $750,000 or more in terms of household income. It'll save small businesses, corporate institutions themselves, state and local governments, tons of money. And if they save state and local governments tons of money, it reduces the taxpayers' commitment to that in terms of household income. It relates to other and absolutely important goals like income and wealth inequality. And there are currently, and probably more, 74 national organizations and 106 state and local organizations, unions, religious groups, civic groups, our revolution groups, chapters all over the United States, that have been fighting for Medicare for All for years. National Nurses United, Social Security Works, Public Citizen, Labor Campaign for Single Payer, Amalgamated Transit Union, International Association of Machinists and Aerospace Workers, International Federation of Professional Technical Engineers, United Mine Workers, United Workers Union of America. The list is vast of the number of organizations that have endorsed the H.R. 1384 on the House side. Its purposes, this institution that Bernie Sanders would help write with his campaign funds, educate, educate, educate. As much as there has been an education process in the United States for Medicare for All, it is still inadequate. We continue to have to educate by numbers, by sheer numbers. X percentage of the American people, adults and young people, have to understand the feasibility of Medicare for All. A lot of work yet to be done. It would have a strong political action, obviously, that's key. Not only in terms of electing representatives to particularly the House, which really only, in my mind, has 41 truly progressive congresspeople, but also to the Senate. We have to elect progressives that have fire in their belly for a Medicare for All single-payer program. We don't want to go another 75 years without that. We won't be here 75 years from now. And that institution would monitor if there is a platform by the Democratic Party that endorses, by some miracle, a single-payer program. What is the party doing with respect to that goal? And educate the American people every step of the way as to whether they're fulfilling their party platform with regard to a health insurance program that's national or not. We've got to care about each other to actually enact any public policy for the common good. And that's why I have here just a reminder: one nation under God, indivisible. From my own personal experience in government and leading nonprofits, do's and don'ts. Don't reinvent the wheel. We had H.R. 676, John Conyers' bill, which he introduced in the House over a course of many years, more than 10 years, probably closer to 14. It was a wonderful bill. I don't recall that there was a Senate bill that related to 676. But then Premier Jayapal, representative, decided to improve upon 676 and create her own 1384. So the time spent on approving a bill, which everyone thought was terrific, in order to establish perhaps a better bill, I don't know. That's time wasted from the education process, from the lobbying process, the confusion that takes, to moving Medicare for All. On the Senate side, instead of Bernie Sanders saying, Pramila Jayapal, I like your bill, I'll strategically copy that bill word for word in the Senate. So there's no time wasted in coming to a resolution in a conference committee with regard to a Medicare for All bill. No, Senator Sanders, God bless him, decides to have his own bill in the Senate and does not completely follow Pramila Jayapal's bill. I would hope that if we have a House and a Senate that is for a Medicare for All system, that we don't go about changing the current bills until we get to the point that there's a conference committee. Don't condone, accept non-support or opposition from any elected official. My own congressman, to put a personal take on this, Tom Suozzi, is an opponent of Medicare for All and has been. He's not a co-sponsor, speaks against it, only talks Republican points whenever he addresses the issue of health care. And his main one is people like their insurance. They want to be on there employer-sponsored health care. Well, COVID-19 has hit his allegiance to that talking point out of the ballpark. Remember his name, Tom Suozzi, Democrat, New York CD3. Do maintain focus. Don't change the goal of that institution to climate change, to taking away tuition debt, to increasing the minimum wage. No, stay focused on Medicare for all. Why? You win Medicare for all, which is the #1 issue now, and particularly with COVID-19, you dilute the control of corporations. And you need to do that in order to begin to tackle other key issues. Do agree on actions, very important. In classic Community Organizing 101, the last thing that you want to do is have a major disagreement on the actions that the organization takes, because then members will go away. And you need that strong coalition in order to move forward. And last and not least, do choose strong, competent, confident leaders. Don't have a chip on their shoulder, are not insecure, don't have huge egos where it becomes more about them than it is about the goal of Medicare for all. I leave you with that thought, and I hope somebody listening has access, as I used to in years past, unfortunately not now, to people that are in a position to think about this and move forward. Someone that has access to Bernie Sanders, to suggest to him, Bernie, your work is not over. You've got to leave us with something, because it's about us, not